Today on Frontiers of Medicine. Gene therapy. It's medicine for the millennium, and doctors are experimenting with it today across the country. We'll visit state-of-the-art projects that could lead to treating diseases before you even have them. Are you allergic to people? Social anxiety disorder strikes more often than you might think, but now there's a new treatment for it, just approved by the FDA. Also, parents, take note. An ear infection vaccine could be in your child's future. These stories and more from the Frontiers of Medicine. Funding for this program is provided by the Medtronic Foundation, celebrating Medtronic's 50 years of pioneering therapies that restore health, extend life, and alleviate pain. Medtronic, when life depends on medical technology.
Welcome to Frontiers of Medicine. Blocked leg arteries often mean years of chronic wounds and eventually amputation. But doctors at Temple University are experimenting with gene therapy to help patients grow new blood vessels around blockages.
Kathleen Quigg says gene therapy is her last hope. The arteries in her leg are so blocked, doctors say. If this doesn't work, they'll have to amputate.
It's painful. It feels like pressure all the time, like if you should take your shoe off and it would go away, but it doesn't go away when you take the shoe off.
Kathleen is part of a select group undergoing an experimental gene therapy treatment at Temple University Medical Center. Here, Dr. Anthony Camerata will inject a growth factor gene into the patient's leg muscles to help their bodies grow new vessels around the blocked arteries. This technique is designed to restore circulation to the limb, relieve pain, and eliminate the need for amputation.
Appropriate candidates for this form of treatment are those patients who have very bad lower extremity arterial occlusive disease, so they have very poor circulation to their foot, many times have non-healing ulcers, bad pain, and are facing amputation if we don't provide additional circulation to their foot. An arteriogram has to show that there's no other standard form of therapy that can be offered with reasonable success.
Really hope everything works out and it turns out well. Believe me, if it helps the pain in my feet, I'll get up on my knees and thank God.
This experiment is one of several gene therapy human trials underway around the country. Under the watchful eye of the Food and Drug Administration, doctors are hoping that by infusing patients with a key gene, they will be able to repair genetic defects and help ease symptoms. While this development is exciting, it may be just the beginning. Imagine being able to treat a disease before the patient even has symptoms. From Alzheimer's disease to cancer. Doctors at the International Cell and Gene Therapy Center in Houston, Texas, are hoping to one day treat individual cells in a lab.
This may well turn out to be the most important aspect of cell and gene therapy because, of course, it's always easier to prevent a disease than it is to treat it.
Cell and gene therapy is a way of repairing or basically reprogramming damaged cells and genes. It involves inserting a working gene to compensate for genetic flaws. Earlier this year at Ohio State University Medical Center, Donovan Decker became the first human to receive gene therapy for muscular dystrophy. In an experiment funded by the Muscular Dystrophy Association, doctors injected the top of Decker's foot with genes for needed muscle protein. Decker is missing that protein due to a genetic condition called limb-girdle muscular dystrophy. The condition damages the muscles that stabilize the hips and shoulders. Normally, victims are in a wheelchair by middle age. Decker is the first of 6 people to be injected with the genes in the experiment. Doctors injected his other foot with a placebo. In 6 weeks, they'll take biopsies of the muscles in each foot and compare them. In the meantime, he'll be monitored closely for any negative reactions, including a possible immune response to the genes themselves, to the proteins, or to the virus used to carry the genes. The Cell and Gene Therapy Center in Houston is using their technology to treat recipients of bone marrow transplants. Here, cells are taken from the blood or bone marrow and grown in a lab. Then the desired gene is inserted into the cells using a dead virus. Then the successfully altered genes are picked out, kept in a lab until they multiply, and then put back into the patient. Eventually, the process may help the body heal itself.
Well, our hope is that we'll be able to cure a higher percentage of patients, and that's certainly what we're aiming for.
Gene therapy has actually been in development around the world for about a decade now. There are only a handful of diseases for which gene therapy has been approved for human trials. Among them are cystic fibrosis, melanoma, brain tumors, AIDS, and now muscular dystrophy.
One of the things we can try and do is treat diseases that are at the moment resistant to conventional therapies.
Doctors see vast potential for gene therapy. It can not only be used to treat diagnosed patients, but it could theoretically be used someday to treat egg or sperm cells to prevent a disease from being passed to a future generation. Doctors also anticipate using gene therapy as a drug delivery system. For example, during blood vessel surgery, doctors could insert a gene that produces an anticoagulant material to prevent dangerous blood clots from forming.
The potential of gene therapy is enormous, and I think only your imagination can limit what you can conceive as where genetic therapy can improve a patient's health.
Despite the promise of gene therapy, it's still highly experimental. Researchers are wrestling with the challenges of how to isolate, extract, and deliver genes more accurately. They also want to be sure the altered gene is properly accepted and regulated by the body. The Cell and Gene Therapy Center is a joint project of Baylor College of Medicine, Texas Children's Hospital, and the Methodist Hospital. Doctors here say gene therapy research is where heart disease research was 30 years ago. It may well be the wave of the medical future.
It's hard to imagine, but some people are so afraid of talking to anyone, they are prisoners in their own homes. They suffer from what doctors call social anxiety disorder. But a new drug therapy is helping many face the world.
Imagine being afraid of speaking to other people. Some people are. 10 million Americans suffer from what's known as social anxiety disorder.
I lived with the anxieties and the fears of interacting with other people, and I just thought it was me.
This woman is not alone. Applying for a job, dating, or just talking to a waiter is terrifying for someone with this condition.
A person with social anxiety disorder is going to suffer from tremendous physical and emotional anxiety whenever they're in certain social or performance situations.
But now there may be hope for sufferers. The Food and Drug Administration just approved the use of a medication called Paxil to treat patients with social anxiety disorder. Paxil has already been approved for treating depression and obsessive-compulsive disorders. But Paxil is the first and only FDA-approved drug for treating social anxiety disorder. Like Prozac, it works by inhibiting the reuptake of serotonin in the brain.
Studies have shown that Paxil can dramatically decrease the symptoms of social anxiety disorder. And I've seen people taking Paxil be able for the first time to comfortably negotiate business meetings or social events.
It's an incredible feeling to go from that fearful victim to a very competent and helpful adult. I'm in control of my life.
Social anxiety disorder is the third most common psychological condition behind alcoholism and depression, yet only 5% of sufferers ever seek help.
People with social anxiety disorder often don't think of themselves as having a treatable illness, so they don't go and seek treatment. They just think, this is the way I am, this is my personality.
Since taking Paxil, this woman has opened her own law firm and finds simple things like asking directions or talking with friends a lot easier.
135,000 Americans have it. One person in every 2,000 is affected to some degree. It's narcolepsy, a neurological disorder that results in extreme daytime sleepiness. But the symptoms don't end there. Narcolepsy also produces sleep paralysis, the inability to move just after awakening or just after falling asleep, and cataplexy, sudden episodes of muscle weakness that can last from a few seconds to several minutes. After years of research, scientists have identified a gene in dogs that causes narcolepsy, bringing a future cure for humans within reach. Dogs are one of the few species besides humans known to develop narcolepsy as a genetic disorder. The gene codes for a receptor called hypocretin-2 allow brain cells to receive signals from other cells. When the gene is defective, it produces a receptor that fails to recognize messages promoting wakefulness. That results in an overwhelming urge to fall asleep. Researchers now know the same gene exists in humans, so naturally the next step will be to pinpoint the exact location on the human genetic landscape. Current narcolepsy treatments, stimulants that have unwanted side effects, alleviate symptoms but don't influence the underlying brain defect. Now, with the identification of this gene, it may be possible to find drugs that work solely on the brain's hypocretin system without side effect. Not only can this discovery help treat narcolepsy, but it may lead to an increase in our understanding of other sleep disorders as well. Medicines could be produced that not only prevent sleep in narcoleptics, but also induce sleep in insomniacs. It would seem hypocretins are going to be a major player in helping many people get a good night's sleep.
Nearly all children will suffer an ear infection before they are 10 years old. Now, a new vaccine may soon protect children from the bacteria that causes them.
An experimental vaccine is showing promise in preventing childhood illnesses like ear infections. This from two recently released studies from the University of Maryland and the Kaiser Permanente Vaccine Study Center. According to these studies, the vaccine produced immunities to all 7 strains of pneumococcal disease, including the common ear infection, sinusitis, pneumonia, and bacterial meningitis.
What we found with the study was the greatest impact of the vaccine are on those children who have repeated ear infections. About 20 or 25% reduction in those kids who get repeated ear infections who may ultimately go on and have tubes put in their ears.
Otitis media, or the common ear infection, affects 7 million Americans each year and is the #1 reason for pediatric doctor visits. Nearly 80% of kids will suffer an ear infection by the time they're 3 years old. Usually, they're simply treated with antibiotics. But recently, doctors have been reporting more and more strains that are drug-resistant.
What we saw is a 7 or 8% reduction in number of visits. So that'll be 2 million visits to the doctor that won't happen, 2 million prescriptions for antibiotics that won't happen, 2 million children crying at night that won't happen. So the impact of this vaccine is going to be quite significant.
If this study yields a real vaccine, doctors estimate it could prevent 65% of simple ear infections and 85% of the more serious strains of pneumococcal disease, including bacterial meningitis. Worldwide, more than 1 million children under 5 years of age die each year from some strain of pneumococcal disease. Those who survive bacterial meningitis often suffer lifelong disability, including blindness or paralysis.
I was told that the bacteria that cause meningitis and ear infections were becoming immune to the antibiotics used to treat them, and I wanted to protect my child.
The vaccine was approved by the FDA for fast-track development. This means its manufacturers, Wyeth Letterly Vaccines, can submit clinical trial information for FDA review before the entire approval application is completed. In the meantime, more healthcare facilities around the country are participating in studies on the vaccine's safety and effectiveness.
We're hopeful that based upon the success of the vaccine in preventing ear infections and preventing other diseases, that possibly by the end of the year the vaccine will be available for general use. And at that point, I would think would be recommended routinely for all infants and young children.
Many kids, after repeated ear infections, end up having to have tubes surgically implanted in their ears. Years of battling ear problems can sometimes lead to hearing difficulties and delayed speech. Not long ago, this is a sound Caleb Martin would have found hard to hear. This 7-year-old boy had persistent ear infections and trouble hearing.
He's had a lot of problems with hearing. His speech was delayed there for a long time. He didn't really start talking till he was about 4.
Continuously saying what? He can't hear you. You have to repeat things 3 or 4 times. He wakes up in the middle of the night crying because of the pain in his ears. It's still a mess.
Now, Caleb is about to get surgical help. He's going to have tubes placed in his ears.
It's a very short procedure, and in the population who needs it, it's a very effective operation.
Ear tubes help firm up the eustachian tube and equalize the pressure on both sides of the eardrum. This procedure allows fluid to get out of the ear and lets kids live without pain.
Parents often will think that it's the child's character or personality instead of realizing it's because there's a hearing problem due to fluid in their ears.
Caleb had one previous ear tube surgery. As in all ear tube procedures, the eardrum incision healed, but after a few months, the tube eased itself out. This time, Caleb's getting a special T-shaped ear tube, which will stay in longer. While the new ear tubes will help Caleb and his parents live more comfortably, doctors testing the pneumococcal vaccine hope their work will someday make surgeries like Caleb's a thing of the past.
The best defense against breast cancer is early detection. A new laser mammography may prove to be an important weapon in that fight.
Mammograms. The word strikes fear in the hearts of many women. First, there's the procedure itself, which many women find painful and humiliating. The traditional mammogram requires the breast to be squeezed and compressed, causing patients discomfort. 40% of women who have a mammogram never go back to get tested again.
The squeezing discomfort in the machine is really uncomfortable.
It's a little embarrassing. I had one today, this morning.
No, I haven't had one since.
There's some discomfort, especially if you're not wise in terms of the time of the month that you go to have your exam.
It can be a little painful. It's not really a pleasant experience.
Traditional mammograms are also not foolproof, especially for women with small breasts, dense breasts, or augmented breasts. And once the mammogram is complete, there often is the nerve-wracking wait for cysts and lumps to be biopsied. But now, thanks to new technology, researchers are seeing mammograms in a whole new light. Beams of light, to be exact. Pulsating lasers that are more exact make a breast exam relatively painless and may end the agonizing wait for many test results. In short, this new technology could make traditional mammography obsolete. This new imaging system is in development and currently in the second phase of FDA clinical testing, meaning it's one step away from approval. It's called CT laser mammography, and it uses the latest in sophisticated laser technology to make mammograms less painful and more accurate. Richard Grable developed the system.
Most other techniques have tried everything from X-ray to sound waves to magnetic waves, microwaves. Didn't leave much portion of the spectrum to use except light. We can use light in ways that it was not possible even 3 years ago. So now we have a non-X-ray source that can give us a good, clear image of what's going on inside the body.
Here's how the CT laser mammography works. During the examination, the patient lies face down with one breast freely suspended through a pocket in the examining table. Beams of light rotate around the breast, gathering information to give doctors a three-dimensional cross-section analysis. Sophisticated lasers are then teamed with advanced mathematical equations called algorithms. The algorithms make it possible to take raw data received from the laser and transform it into a highly detailed picture of the breast. Its makers say the image produced is more accurate and easier to read than traditional X-ray mammography. There are other important benefits to CT laser mammography as well. Traditional mammography X-rays have difficulty getting readings on women with small breasts, augmented breasts, or dense breasts. That's not a problem when using lasers. In fact, the lasers can even differentiate between a cyst and a solid mass, reducing the need for biopsies and the anxiety of waiting for test results. And in an age where cosmetic surgery is common, the CT laser can accurately see tissue behind breast implants and detect if those implants are leaking. According to Imaging Diagnostic Systems, a CT laser mammography is expected to cost about the same as an X-ray mammography, and an entire exam takes less than 15 minutes. Another benefit: information is gathered on CD-ROM for immediate recall and contains a patient's entire medical history. That CD also contains an atlas of reference studies for comparison. But for many women, the best advantage of this laser technology is the elimination of the painful breast squeezing and compression associated with standard mammograms. By making the discomfort disappear, mammographies are more accurate. This new laser technology makes this emerald light a real gem in women's health care.
Since we first aired this story, advancements in laser technology are increasing the odds of survival for victims of breast cancer. Not only are lasers being used in diagnosis, but at the University of Arkansas, researchers are developing a way to use lasers for non-surgical lumpectomies. Here's the story.
The war on breast cancer is reaching another frontier at the University of Arkansas for Medical Sciences. There, doctors are using lasers to perform lumpectomies with minimal cosmetic damage to the patient's body. Doctors have long been concerned that their patients ignore early signs of cancer or neglect to do preventative care in order to avoid the disfiguring results of lumpectomy surgery. After 9 years of research, they've developed the rodeo-directed MRI and laser lumpectomy. The rodeo MRI was developed to determine more accurately the extent and position of a breast tumor. It is twice as sensitive as the traditional mammogram. For example, in this patient, a mammogram shows a small tumor treatable through lumpectomy. But when that same patient underwent a rodeo MRI, additional growths were found that were larger and in this case more malignant than the one that showed up on the mammogram. If this patient had received a traditional lumpectomy, she would have been facing more surgery down the road. The process is also more comfortable than a mammogram or surgical lumpectomy. The patient lies flat on a table and slides into the MRI machine. In the case of a lumpectomy, the technician finds the coordinates for needle placement and enters them into the computer. The needle used is smaller than the traditional biopsy needle. It's about the size of the kind used for drawing blood. Once coordinates are established, the needle is inserted and a tissue sample removed for lab work. Then a fiber optic is inserted through the same needle. The fiber optic is connected to a laser to destroy the tumor with heat treatment. And the process takes about 10 minutes. Here we can see the tumor being destroyed. For larger tumors, multiple fibers are used. So far, the rodeo-directed MRI and lumpectomy has been well accepted by patients. Its developers at the University of Arkansas say it costs less than the traditional lumpectomies. It can be done as an outpatient procedure with local anesthetic. But the best part? Doctors say their patients have a much better self-image after this procedure than those who undergo the often disfiguring lumpectomy surgery.
Remember, the more information you have, the better healthcare consumer you'll be. A good place to start is our website, which has information about the stories covered by Frontiers of Medicine, plus links to other health information.
Next week on the Frontiers of Medicine. Could a common hepatitis B vaccine be preventing some types of cancer? We'll find out. Is your eyesight deteriorating with age? It's called macular degeneration, and now there may be something you can do about it. Also, a new way to treat brain tumors could one day unlock the door to more effectively treating all types of cancer. We'll meet the scientists who are developing this novel approach to a deadly disease.
Thanks for watching. I'll see you next time on The Frontiers of Medicine.
Funding for this program is provided by the Medtronic Foundation, celebrating Medtronic's 50 years of pioneering therapies that restore health, extend life, and alleviate pain. Medtronic, when life depends on medical technology.